behalf of A4M, I'd like to introduce myself. My name is Jordan Nelson, and I am the marketing coordinator for A4M. I'd like to thank you so much for participating in this webinar. During this webinar, we will hear from both Dr. Pamela Smith and Lizzie Dragon from PCCA, who will announce and describe the partnership between A4M and PCCA. Dr. Smith spent her first 20 years of practice as an emergency room physician with the Detroit Medical Center. She is a diplomat of the board of the American Academy of Anti-Aging Physicians and is an internationally known speaker and author on the subject of metabolic anti-aging and functional medicine. She is currently the director of the Center for Healthy Living and Longevity and the founder and director of the Fellowship in Metabolic Anti-Aging and Functional Medicine with A4M. Dr. Smith is also the director of the Master's Program in Metabolic and Nutritional Medicine at the University of South Florida College of Medicine. Lizzie Dragon is PCCA's Vice President of Marketing, Education, and Member Relations. In that role, Lizzie has demonstrated herself to be energetic, articulate, and passionate, and has transformed the way that we relate with our members today. Her primary roles are to facilitate strategy and planning for PCCA, as well as to enhance our members' experience and create opportunities to help them grow their pharmacies. She leads the marketing of PCCA to its members, practitioners, and patients, and she influences the educational offerings offered to PCCA members and the overall enhancement of the members' experience through the Member Benefits Program. Lizzie has been a prominent presence in the compounding world for more than 12 years. She is a graduate of Tulane University with a BA in Communication. Lizzie facilitates and speaks at a variety of PCCA educational events. In addition to her work with PCCA, she spends time volunteering for a variety of nonprofit organizations, including the Fort Bend County Women's Center. Thank you both for joining us today, and I'll go ahead and pass it off to Dr. Smith.
Hello, everyone.
The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. It's my privilege this evening along with Lizzie Dragon to announce a partnership between the American Academy of Anti-Aging Physicians and PCCA. It's been my personal privilege to be a speaker for PCCA for over the last 10 years. And I've very much enjoyed learning and now implementing the triad. It is so important to have a triad between the pharmacist, the patient, and the practitioner. And with this situation where we're going to be working between A4M and PCCA, we will be able to further help patients and to strengthen the triad between the patient, the practitioner, and the pharmacist. So I'm so very excited in looking at different things that we can do. So for my component today, I would like to explain some of the programs that we have at the American Academy of Anti-Aging Physicians that we will be doing in conjunction with PCCA. The educational training programs are for everyone. It really takes all of us to help the patients be healthy. Whether we're physicians, pharmacists, PharmDs, nurse practitioners, physician's assistants, exercise physiologists, nutritionists, PhDs, chiropractors, naturopaths, all of us, to have a metabolic anti-aging functional regenerative approach to a patient, which is really individualized care. This is very much personalized medicine. And that's the reason why compounding is so important, because then we can compound something that is for one patient and one patient only. One size does not fit all. All of the modules that we offer can also be taken for credit from the Marzani College of Medicine at the University of South Florida. The University of South Florida is the 4th largest university in the United States. It has 48,000 students, and it's extremely well endowed. It has the Bird Center, which is the #1 center in the United States for research in Alzheimer's disease. Also, the University of South Florida College of Medicine has a research center called CAMEL, which is the #1 training center in the world for robotics. So we're very privileged to also be affiliated with the University of South Florida College of Medicine. Each module that we offer is 3 days in duration, lasting 8 hours a day. Each module requires attendance at 5 webinars as well. The modules can, many of them, be taken online or in person. The webinars are held on different evenings at 8 o'clock Eastern Standard Time, but they are all archived, so that the person that is taking the courses will be able to access it at any time. If the person is taking the module for credit at the University of South Florida, there is some additional coursework, which is minimal, but it's additional to show the state of Florida that they have actually learned the material. So there's open book examinations and case histories to write. The fellowship itself in anti-aging, regenerative, and functional medicine is composed of 5 modules. The first module is endocrinology. The second one looks at hypertension, insulin resistance, and hypercholesterolemia. Module 3 is on gastrointestinal health, neurology, and neurotransmitters. Module 4, amino acids, fatty acids, nutritional depletions caused by medications, and the body's ability to detoxify. Module 5 is clinical intensives, where we have practitioners look at many different cases that are their actual case histories and how they treated the patient. Because we are the only program of its nature affiliated with a medical school, we are very blessed to have wonderful speakers from both anti-aging and from PCCA to help teach these courses. For example, hypertension in Module 2 is taught by Mark Houston from Vanderbilt. It's absolutely fabulous. Nutritional depletions caused by medications is taught by Dr. James Laval, a wonderful pharmacist who really brings home the idea that every prescription the practitioner writes for causes at least 1 nutritional depletion. The advanced fellowship is modules 1 through 5, plus modules 6 through 8. Module 6 is an introduction to functional medicine and neurology. Module 7, brain fitness, mitochondrial health, and autoimmune disorders. And Module 8 looks at functional medicine labs, oncology, psychiatry, and sleep medicine. You can go on to get a master's degree in medical sciences with a concentration in metabolic and nutritional medicine from the Morthani College of Medicine at the University of South Florida. To get the master's degree, that is modules 1 through 8, 2 electives, and an online ethics course. The University of South Florida is a state school, and in Florida, all medical school degrees that are provided do require an ethics course to be taken. There are many different electives to choose from: pediatrics, toxicology, homeopathy. We have the only homeopathy course that is certified by a med school in North America, and the entire course is taught by Dr. James Laval. So he brings in a practitioner's viewpoint along with the pharmacist's viewpoint. It's fabulous. We have IV therapies, acupuncture, genomics and proteomics, pain management, and advanced autoimmune disorders. There's now 104 autoimmune disorders, something that touches many of our patients. You can also get a certification. A certification from the University of South Florida College of Medicine is 4 modules. And so you can get one in weight management, brain fitness, advanced cardiovascular therapies, lifestyle health coaching, sports medicine and nutrition, advanced endocrinology, or addiction medicine. If you really think about it, 70 to 80% of all of our patients have some form of addiction. We have a brand new module that we're really excited that we're going to be holding in June the 26th and 28th, at the Marriott on the Beach at Delray Beach, Florida. This module is one on the nuts and bolts of writing prescriptions for compounded medication. At A4M and at PCCA, what we have discovered is that a lot of practitioners do not know how to write the actual prescription for what they're looking at. For example, metformin. Metformin sometimes causes gut disturbances in our patients, and they have a hard time taking this medication. Very important for the diabetic. What we can do is put metformin transdermally on the skin. It gets absorbed very well and does not cause the GI disturbances that you would get when the patient gets this medication by mouth. I was very blessed to learn how to do that from a PCCA pharmacist, Matt Bruder. So a wonderful thing to learn, and this module is going to focus on many formulations from many different areas, looking at the nuts and bolts of writing these prescriptions for compounds. Autism, BHRT, cosmeceuticals, dermatology, anti-aging compounds, dental health, flu outbreak, female sexual function and libido, hospice, men's health, New Year's resolutions, eye health. Other things that will be covered in this prescription writing module are oncology, pain management, pediatrics, podiatry, romance and relaxation, scars and wound care, sports medicine, summer and wintertime compounds, women's health, travel needs, and more. We're very blessed that some of our compounding pharmacists that are PCCA pharmacists are going to be bringing some of their hidden secrets that they have for compounding that they've developed and used over the years. So this is a one-of-a-kind module that's never been done anywhere before. So I'm very happy to be announcing with Lizzie Dragon from PCCA this partnership between PCCA and A4M. What it's going to bring about is more healthy patients. Lizzie?
Awesome. Thank you, Pam. That was fabulous. PCCA is so excited about this partnership, and personally, I could not be happier about the opportunity, not only for PCCA, but really for everybody on the phone, our members. Through this partnership, essentially, we are going to be able to, together, PCCA and A4M, will help facilitate relationships between PCCA pharmacists and A4M doctors. And it makes sense. PCCA is the leader in personalized therapy for patients through compounding, and A4M is the leader in personalized therapies through functional medicine. Like A4M, like Pam has just said, we feel like this synergy will offer the greatest opportunity both for pharmacists and physicians. And Pam, you really said it best at the beginning. It's truly, realizing the triad as we've always discussed it. So just to let you guys know a little bit of our role in this partnership, it's essentially to let the doctors know that quality exists in compounding. We can best support you by amplifying who we are and really what is behind you as a PCCA trained pharmacist, and bring more credibility to your efforts in your practice, everything from your service level to that finished compounded preparation you're giving your patients. The doctors are going to know that you're working with a reliable source in the drug supply chain, and that they'll have peace of mind with the better understanding of quality and transdermal technology and how it can help their patients. So I think that essentially it really validates your services and products in the partnership you have with the doctors. A4M has an incredible fellowship program. We've just heard about it. And really I'm just here tonight to endorse it and hope that more of our members will take advantage of it and ultimately build their practice through enhanced clinical knowledge. And then I look to you as a PCCA member and say, what's the role of the member in this partnership? It's really to take advantage of the opportunity that exists. There is and the responsibility to build physician relationships through shared learning experience. Consider joining the fellowship. Refer your doctors into the fellowship. Not only can you meet doctors who you'll be side by side with, but who are some of those big prescribers you have, or maybe new relationships you want to create where you could refer someone into the fellowship? I think my first A4M meeting was 2 years ago, and I ran into one of our members there, and he said he had introduced, or originally his doctor had introduced him to A4M, and then he introduced his doctor to our BHRT event in Las Vegas, and they took turns and were building their relationship and solving patient cases by attending this education together, and I really think that's a best practice. The biggest thing that our members can do is take advantage of opportunities as they come up. Pam, you just talked about the new module, which is going to be really cool. I also wanted to mention a partnership that we've got with A4M in Vancouver. We have a BHRT event in Vancouver, November 7 and 8. Traditionally, this is our advanced BHRT that we have for our members, and invite them to bring their doctors, and it's traditionally been a Canadian event. However, through our partnership with A4M, we're now able to grow this and expand it to become a North American event. You're not going to want to miss it. There is going to be a phenomenal clinical agenda, networking, opportunities, great speakers, and I kind of want to ask everybody on the call to consider saving the date now, November 7 and 8 in Vancouver, and consider bringing your staff and your doctors. You can see this partnership in action firsthand. And I know for a fact this year, we think it's going to go great and be an annual event, and this year it's definitely going to sell out, so please register early. So what's in it for you? As you're listening to all this, you're saying, okay, what does this really mean to me and my practice? Pam talked about enhancing the triad, but what does that look like to you as an individual? Well, there's essentially 4 things, and that's a short list, but everything on this list is high impact. So the first thing it means to you is direct contact. Direct contact with physicians who need and use compounding pharmacists, again, in a shared educational experience. So this isn't where, when you think about your typical doctor, and knowing compounding still less than 1% of the prescriptions that are written in this country, think about the fact that these doctors, probably half, if not more than half of what they write is compounded. So what a great partnership to go in and great relationship to build. So number 1, direct contact with these physicians. Number 2, the ability to build and then continue the developed relationships that you get while going through the fellowship. And 3 and 4 are pretty similar, but just ultimately knowing that the profession will grow exponentially and that more patients will have access to compounding. Another way of saying this is that the number of prescriptions being written will significantly increase. And that is just awesome. Essentially, I just want to reiterate that I'm so excited, PCCA is so excited, and that there's a breakthrough happening here that's occurring through this partnership, and it's this enhanced relationship between PCCA pharmacists and A4M doctors. This is the key to dramatically growing the compounding profession. As I just said, you've got these docs focused on personalized patient care, learning with pharmacists who are focused on personalized patient care. How can we miss working together? Pam, I want to thank you and Jordan for having me on the call. I think it's wonderful what we're doing.
I absolutely agree, and that was great, Lizzie. Thanks so much. And we do have some questions, so I'll go ahead and get into those. This first one is for Dr. Smith. How do I get involved? Do I need to be an A4M fellow?
Well, in order to be an A4M fellow, let's make it really easy for you. You can have my personal email. That is Pepper, P-E-P-P-E-R, the number 4, at S as in Sam, B as in boy, C as in Charlie, global.net. That's Pepper4 at sbcglobal.net, and I will be happy to personally work with you to assign you an A4M representative so that you have your own A4M rep. For example, the compounding module that is going to be in June, this is an excellent marketing opportunity for a pharmacist. We have one pharmacist already who's going to bring 10 providers because that will grow the amount of compounds that is being written for that pharmacy exponentially.
Okay, and now this next question is for Lizzie. If you exhibit, will you be referring me doctors?
It's a great question, Jordan. So there's really a twofold answer. Many of the A4M doctors are already working with PCCA pharmacists. And if that's the case, our goal is to enhance that doctor's awareness of compounding. Our research has shown if someone is sending you BHRT prescriptions, they may have in their mind that's all that you can do. You're the pharmacist who makes the hormone scripts for their patients. They have no idea that you could also be serving their patients in pain, wound, scar, and many other therapeutic areas. So in that case, if they're already working with you, we're not going to be creating a referral. We're going to say, go ask your pharmacist. So our goal will be to heighten their awareness of other compounding opportunities and then ask them, go ask the pharmacist you're working with if for example, you can make Praxil for them or Praxil prescription. So that will hopefully bring you more business. If the doctor is not working with a pharmacist, which so far our research shows is somewhat of a minority in A4M, although there's new people coming to the table all the time, and those new people are not working with pharmacists, we are looking to develop a referral program, and we want that program to be fair and balanced. And we're really looking to our members to help us create it, endorse it, and get excited about it. So we've asked over 50 members so far what should be in the program. We are collecting research. And if you're online tonight and you have some ideas for what should be in a referral program, please contact me offline. I really sincerely want to hear from you. My email is ldragon@pccarx.com. Again, it's ldragon@pccarx.com. And you can just call my cell phone directly as well. And my number is 281-704-5090.
Okay, excellent, Lizzie. And one final question. Is PCCA going to sell to doctors directly or change its business model?
The answer is no. We're not going to be selling products to doctors or changing our business model. What we do offer these doctors is information about who you are and what you can do for them. That information includes studies to validate what we know about compounding and continuing education through PCCA education and through our A4M partnership. Again, just please remember, as Pam said, the advanced compounding module coming up, and then also I wanted to reiterate about Vancouver, again, to see this in action, November 7 and 8, the North American BHRT, and there's no better way to build a relationship with the doctor than sitting next to them and learning in the same room, the same information, and we're committed and convinced that this will be transformational for you and your practice.
Okay, excellent. That's all for questions that we've had submitted. If Lizzie or Dr. Smith, if you have any final remarks you'd like to mention, go ahead and do so.
I just want to reiterate that we are very privileged to have this partnership between A4M and PCCA, and it is only going to help us have healthier patients, but it's going to help you as the pharmacist really be able to help clinicians, many of which are not good at compounding and writing those prescriptions, help them go forward to have other areas of expertise, as Lizzie was suggesting. Maybe the doctor right now only writes prescriptions for pain control, but through your help as a wonderful compounding pharmacist, you'll be able to help them branch out into all kinds of other areas like wounds, scars, etc. And what I always try and encourage the fellows that are practitioners in the fellowship is that your compounding pharmacist should be your best friend. My compounding pharmacist is literally my best friend. My best friend is a PharmD, and it's a wonderful relationship to have. And again, it is all about the triad: the patient, the pharmacist, and the practitioner.
That is just awesome. I love that the compounding pharmacist is your best friend. I just want to say ditto and reiterate what Pam said and really let people know. I mean, the more research we do and working with Pam and getting to understand physicians better and learn how they think, especially in the specialties, there's starting to be, we've got diversity in compounding. So you guys all have something to offer these doctors, and that's where one of the real opportunities is. And the doctors that have the specialties aren't aware of all the things that you can do. So we're excited to heighten that awareness. We're excited to be able to create this partnership so that we can facilitate best friendships being formed and maintained and grown. And as always, and with PCCA Education, we're a learning organization, and our success is dependent on the members' success. So we're entering into this partnership to help you be more successful, and we're grateful for you, grateful for A4M, and knowing that together, we can go out and help more patients. Thank you.
Excellent. Well, again, thank you so much, Dr. Smith and Lizzie. And I mean, from an A4M standpoint, we're just so excited about this partnership, and thank you for your time and that very informational webinar. And I encourage any attendee of this webinar who has any questions, please contact the A4M office or PCCA. I'm sure everyone would be very happy to and excited to answer your questions. Thank you, everyone, for your time, and look out for emails with more upcoming events and information. And I'd like to end it here. Thank you so much, and good night.